Hi guys, it's Andy McDonald, physio and strength and conditioning coach, and welcome to the Informed Performance podcast. This episode today is a new style of episode that we're really pleased to be announcing and releasing in addition to our current traditional episodes, and it's going to be called Research Unpacked. This additional type of episode will be released under the current stream of episodes that you're used to listening to, and essentially we will be providing you with a short and punchy research summary where the author of a paper or body of work is interviewed to concisely bring their work, their reasoning and their findings to light. The host for Research Unpacked will be Alistair McKenzie, a sports physio working in academy level football in the English Premier League. Alistair, along with the guest, will efficiently introduce you to interesting work that can inform your practice in performance and sports medicine, hopefully saving you the time and effort that's required to be up to date, but in an interesting and hopefully digestible style. As I said, don't worry, we will still be releasing our traditional style of episodes where myself and/or Ben Ashworth will continue hosting, but we're hoping you enjoy these Research Unpacked episodes and we hope you get a lot out of them. Whatever your feedback, please contact us via social media because we're really keen to engage with you and hear your thoughts on this. You can find us at Informed Performance on Instagram or at InformPod on Twitter. I will now stop hogging the microphone and I'm going to hand over to Alistair for his first episode of Research Unpacked.
Hey guys, welcome to Research Unpacked from Informed Performance. I'm Alistair McKenzie, a sports physiotherapist from the UK, and on today's episode we have part 1 with Dr Andras Hegyi. Andras is a postdoctoral researcher currently based at the University of Nantes in France. As part of JB Morin's research group, Andras is currently researching to identify key determinants of sprint performance in elite athletes. In part 1, we discuss his first study as part of his PhD, which was the first study to use high-density electromyography to compare muscle activity of the hamstrings during the stiff leg deadlift and the Nordic hamstring exercise. So let's jump in. Andras, thanks for coming on the show, mate.
Thanks a lot for having me.
Before we get started, Andras, can you just give the listeners a bit of a background on yourself and your journey through academic research so far?
Sure. So I've come from Hungary. I did my university studies in Hungary in Budapest at the Semmelweis University in kinesiology. So it's basically the study of movements. So it's a very broad area. And already in the second year, I got really interested in biomechanics and I joined PhD students and I kind of got sucked into the research life. So it wasn't really a question to me to start a PhD. And I had this fantastic opportunity to move to Finland, to Jyväskylä, to do my PhD. And during my high school years, I played football. So I was quite interested in football and hamstrings. So basically, I did my PhD on hamstrings. So I spent 5 years on that. And then last year, I got quite tired of the cold weather. So I moved to France, much warmer country. And now I'm doing my postdoc in France at the University of Nantes.
Yeah, and being from England, mate, I don't blame you wanting to move somewhere warmer. I think that crosses our mind every day. But let's talk about your first study that you published as part of your PhD, comparing regional muscle activity of the hamstrings in the stiff leg deadlift and the Nordic. So how did this come about and why was it an important area to explore further?
Yeah, so in this paper, we were really interested in the activation of hamstring muscles using high-density EMG. So basically, when you think about the background of this study, well, there are many papers discussing regional distribution of activation of different muscles, and these papers use either high density EMG, that's what we used in our study on hamstrings, or there are papers using different electrodes on different regions of the muscles, like conventional EMG electrodes. So the EMG is, or electromyography, it measures the activation of the muscles, so the activation of the motor units. And there is another method which is used, muscle functional MRI, which measures the transverse relaxation time of the muscle. So basically the metabolic activation of the muscle. It's also used to define the activation of the muscle and distinguish between different muscle regions. And on hamstrings, there has not been studies using high density EMG. There was one study from Brett Schoenfeld, who had electrodes, conventional EMG electrodes on the proximal and distal side of the hamstring muscles. And he compared one hip dominant and one knee dominant exercise. And it seemed that if you have a hip dominant exercise, because hamstrings cross the hip and knee joints, so these are biarticular muscles. When you have a hip dominant exercise, then the proximal region of the hamstrings is more activated. But if you have a knee dominant exercise, then the distal region is more activated than the proximal region. But the limitation with this is that the conventional EMG electrodes, they are usually quite large, and the inter-electrode distance is also quite long, which means that it's not very selective. So it might be that the signal you measure is not coming from the target muscle, but it's also coming partly from neighboring muscles. So we felt like there is a room for improvement here. And with muscle functional MRI, we also see that the hamstrings are heterogeneously activated within each hamstring muscle. So we really wanted to see the neural representation of this phenomenon. And with high density EMG, there are several studies showing that, for example, the regional activation may be related to regional hypertrophy. It's not shown for many muscles, but for some. And for example, with pain or injury, the distribution of activation may change. And it's being linked to specific movements. For example, in the rectus femoris, which is part of the quads, it's a hip flexor and knee extensor. In walking, if in the early swing phase, the muscle acts as a hip flexor. So the proximal region of the muscle is activated, but in the stance phase, when the muscle acts as a knee extensor, the distal region of the muscle is activated the most. So basically, we try to follow this line on hamstrings. So we compared a knee dominant exercise to a hip dominant exercise, and we put these high density EMG arrays over the biceps femoris and the semitendinosus. So it's basically a line of electrodes. So we have 16 electrodes along the muscle. So it covers a much larger area of the muscle. So it gives a more comprehensive overview of muscle activation. And we are able to assess regional differences within the muscle with this method. So basically that's how we got into this study.
Yeah, brilliant, mate. And this was the first study, I think, to use high density EMG on the hamstrings. So what did you find when you analysed the data in comparison to previous literature?
Yeah, so for the biceps femoris, we found quite, well, for both muscles, we found regional differences within the muscle. But the distribution of the EMG was different between muscles. So for the biceps femoris, the activation was the largest in the distal region in both exercises. And in the semitendinosus, it was the largest in the mid to proximal region in both exercises. So we couldn't see this exercise specificity or that the exercise really affected the regional distribution of the muscle, even though the differences between regions were larger in the Nordic hamstring exercise than in the stiff leg deadlift exercise. So the magnitude of the differences between regions was different, but overall the distribution was quite similar.
Yeah, that's really interesting. So basically the Nordic has a larger intermuscular difference between the semi-10 and the biceps femoris long head, but within the muscle, the distribution of activity is fairly similar across the two exercises.
Yeah, exactly.
So from a methodological perspective, I know it's really important to have a good understanding on like normalization techniques. So can you discuss a bit around normalization and the different types there are and what you used in this study and how we might interpret that?
Yeah, so we normalized to MBC. So basically, they performed maximal knee flexion, isometric knee flexion. And we also had another task, which is not used frequently, which is the combined hip extension and knee flexion maximal voluntary contraction. Because the hamstrings are biarticular, so they contribute to hip extension as well. So basically, we thought that maybe if you perform this combined contraction, then you achieve higher activation in the muscles. So we use this. Basically, we use the highest activation we could achieve for each electrode with an MVC. And of course, there is lots of debate about normalization of the EMG signals. And for example, it may change with for example, some studies show that if you have a knee flexion MVC with a more flexed knee position, then you achieve higher activation in the semitendinosus, and in more extended, you achieve higher activation in the biceps femoris. And probably the regional distribution also changes when you perform different tasks. For example, we recently published a paper with comparing the knee flexion MVC to this combined hip extension and knee flexion. And we could see that in the middle region of the biceps femoris, we achieved higher activation with this combined contraction, but not in the proximal and distal regions. And it wasn't seen in the semitendinosus muscle. So of course, the task you perform affects the activation of the observed activation of the muscle. So we always have to be very careful with how we interpret the magnitude of the EMG signals, or when we compare different muscles, it can also be affected by the normalization. And of course, there are some studies which normalize to sprinting, because we can see that in sprinting we have a very high activation in the hamstrings in the late swing phase. So basically that's also one way, but then you allow for individual coordination strategies, and also it's not so not so controlled as an MBC. So MBC is still the most accepted method for normalization.
Yeah, brilliant. And we are discussing in a follow-up part the recent paper you published on high density EMG during varying sprint speeds. So keep an ear for that one. But just to sum up, I guess from a clinical viewpoint, what do you think are the key practical considerations that can cleanly be drawn from this paper, or where's some of the future research needed to build from this?
Yeah, so it might disappoint for some of the audience, because it's a cross-sectional study with EMG only. So it's very difficult to say anything about clinical implications safely, as you said. But it's quite interesting that the activation was the lowest in the proximal region of the biceps femoris, because that's where most hamstring injuries occur. So it's just a question that is it possible that you cannot really prepare that region for this or for sprinting when high activation is needed, or we could probably assume that because the Nordic hamstring exercise, the activation was much higher in Nordic hamstring exercise than in the stiff leg deadlift, then probably the adaptations are also more pronounced after a Nordic hamstring exercise intervention. But it may not be true again, because activation is only one factor which affects the adaptations in the muscle, and muscle length, for example, is another important aspect. So it's a tricky question.
Yeah, and Andrew Vygotsky, I think, published a review in 2018 on how to interpret EMG studies, which I found really useful. And he included things like the role of non-contractile tissue and force length curves and muscle architecture, which all contribute to force production around a joint and will influence adaptation. And he describes muscle activity of EMG as like a scaling factor to the maximum potential of active force at a given fiber length and velocity. So it's really important, I think, when from a clinical point looking at these studies, to have an understanding of the fiber lengths changes and the velocity of movement as well as EMG at the same time.
Yeah, exactly.
Whilst we're on interpreting EMG studies, are there any other limitations that people should be aware of when reading this kind of paper that involves EMG?
Yeah, definitely. So, for example, with EMG, we should always mention crosstalk, which means that it may be that you don't measure from the target muscle, but some of the signals. So the signal may be contaminated by the activation of neighboring muscles, which we always mention when we talk about EMG, but with high density EMG, the electrodes are very small and the inter-electrode distance is also smaller than in conventional EMG. And we also use ultrasound to define the middle of the muscle. So we put the electrodes as far from the muscle borders as possible. So we really try to minimize it, but at this point, we don't have data to show that the crosstalk is really minimized. So we should always take this into consideration. And of course, the EMG signals are affected by other factors. So as we mentioned, the normalization is important to mention. And also for example, the rotation of the fascicles under the skin is another issue. So if it's different between regions, then it can also affect the activation to some extent. Maybe maybe we are just too cautious when we say it, because we see similar distribution with muscle functional MRI than with high density EMG, but it's also important. And in the fusiform semitendinosus, this effect is not really valid, probably. But probably these are the most important to mention with regarding EMG.
Yeah, that's brilliant, mate. And well, I guess just to finish up, can you just summarize some of the key points that you think you want people to take away from this research?
Yeah, so the first key point is that the activation of the hamstrings is heterogeneous within the biceps femoris and semitendinosus, and the differences are quite large. So when you use only one pair of electrodes over the muscle, then probably it will not describe the activation of the whole muscle accurately. And this might affect the interpretation on the activation of the muscle and when you compare different muscles. And this may be one reason why we have so many discrepancies between EMG studies when assessing the intramuscular distribution of EMG activity.
Yeah, excellent. And thank you, mate. And that brings us really to the end of part one. But In the next part, we're going to be discussing Andreas' follow-up studies on hamstring muscle activity during a large variety of exercises and variations of the Nordic hamstring curl. So thank you for listening, and catch you next time for part 2.